Hello, everybody. I am Dr. Joel Richnack, and I want to thank you all for joining us tonight on another version of our webinar, where I hope to impart upon you all a little more information on this very exciting world of regenerative medicine, a field that I'm very passionate about, and have found that since bringing this to my clinic has been a very powerful treatment option, particularly if conservative treatment has failed. So before jumping in, a little bit of information on myself. I've been a practicing physiatrist here in Grass Valley for over 18 years now. I am dual boarded in both sports medicine as well as physiatry. And I have been running a clinic here in Grass Valley for, again, 18 years with my partner, Dr. Mike Jensen. I've been a provider of Regenix for 6 years now. I can update some of these slides. But to be fair, I've been practicing some form of regenerative medicine since my days in residency, which is approximately 20 years ago. And just another piece of information about myself is I've led a very active lifestyle for the majority of my life. And I really have found that this active lifestyle has not only shaped my life in many ways, but has really shaped and developed my clinical practice over the years. And what I mean by that is, when I first started being active, it was really a form of recreation that ultimately allowed me to have adventures and explore the beauty of the Sierra Nevada mountain range, to which I was fortunate to grow up in. But eventually this fueled a deep curiosity to learn more about, what makes the body move, what makes it tick, what makes it function. And then that spurred into, my career choice of pursuing medicine. So, it really has developed me clinically from that standpoint. But like anybody who's active, I've had my fair share of injuries. And I have found that I've learned a tremendous amount about each and every injury that I've gone through. I've learned, how the body heals and how to rehab the body after these injuries. And not only that, but I've learned how to get back to these activities that perhaps an injury took me out of. So again, it's taught me a lot about not only the body, but how to apply this to medicine. And I've been fortunate to be able to parlay these skills and information that I've learned into helping my patients. And ultimately, it's really helped develop the treatment philosophy that we incur here in Mountain View Rehabilitation. And that is, we really have a passion for getting people back to moving again. Again, particularly not only to help them heal and rehab from these injuries, but again, getting back to these activities that many of us are passionate about. So that's a quick introduction. Why are you all here? Well, most of you are dealing with your own pain issue, orthopedic issue that has produced these symptoms of pain. Many of you probably are very familiar with just having downtime, not being able to pursue interest or activities that you want to be doing because of this particular orthopedic issue. Others have tried various conservative treatment options and have been told that the next step is surgery, but you're trying to find alternatives to surgery. Or you've seen a surgeon and been told that you're not a surgical candidate. So ultimately, you're here to learn more about options. And of course, don't want to live on medications and as I say, get back to these activities that we all are passionate on. So in today's discussion, we'll start off by just going over some of the traditional treatment options in orthopedic care. Then we'll follow that up by introducing this world of regenerative medicine, defining regenerative medicine, as well as another field of medicine called interventional orthopedics that I hope to impart upon you is really key to the success of regenerative medicine. And then I'll explain a little bit more about this company that I'm affiliated with, Regenix, and why Regenix, this approach to regenerative medicine is so different than any other approach or option out there. And then we'll dive into some of the misrepresentations in this field of regenerative medicine and try and explain that. And then we'll finish up with a question and answering session. So current options in orthopedic care, most of you are familiar with this. You know, many of us start our journeys upon trying to address these injuries through working with pharmaceuticals. And if that's not successful, then we oftentimes look into conservative treatment. And then traditionally, if all else fails, we typically are guided into the surgical direction. So again, many of you are probably familiar with this journey. Many of you start, if you have some sort of injury, start with just taking medications, maybe over the counter, Tylenol or ibuprofen. And if that's not successful, we may get more of a prescription strength medication from our primary care physician. But quickly we learn that medications are typically a Band-Aid at best. And of course, many medications have side effects, and some of those side effects can be quite serious. The next step usually involves pursuing some sort of conservative treatment. And that could be anything from chiropractic treatment to acupuncture to physical therapy. And to be fair, I am a rehab doctor at heart, so I strongly believe in the conservative model, particularly of physical therapy. And anybody who comes into my clinic, I always try and explain the goals of treatment, which are first and foremost trying to address the pain issue, which is then followed by going through the rehab process, which is oftentimes learning ways to correct mechanical deficiencies that had led to the injury in the first place. And I would say a good 80% of the time, a good physical therapist working on the right diagnosis is successful at doing this. If the conservative treatment is not effective at addressing the pain, then sometimes we have these other alternatives, including injections, oftentimes starting with a steroid injection, or in the case of knee arthritis, we may even do these gel injections. But again, they are limited to, not always successful. And of course, steroid has its own issues, predominantly of which is it can weaken tissue and sometimes even make the injury worse. So again, classically, if all else fails, we're typically guided to one of my surgical colleagues to consider removing tissue, repairing tissue, or even replacing the tissue. But we are finding that there are some holes with this treatment option as well. In some cases, the procedure itself is ineffective. There are risks, of course, to surgery and the accompanying anesthesia that involved with surgery. And even if it's an effective surgery, it doesn't necessarily work for everybody. And then ultimately, once done, it can't be undone. So we're finding that there's some holes with the surgical option. It's not the panacea. And interestingly enough, there's been more research looking at the outcomes of surgery in the past 5 years than there has been in the past 70 years combined. And much of this research as of late is telling us that it's not always effective. In fact, the research tells us that 53% of the time, it is ineffective. So clearly there's holes in this model. And so, of course, that begs the question, what are the alternatives? Well, we'll spend the rest of tonight talking about regenerative medicine, this world of regenerative medicine, which, as I alluded to earlier, I've discovered to be a very powerful alternative to surgery. So what is regenerative medicine? Well, this is using our own cells, our own very powerful healing cells, namely platelets and stem cells, which can repair tissue, particularly in the case of tendons and ligaments, meniscus, and other soft tissues, including nerves. Or in the case of degenerative changes, help alleviate symptoms and restore health to that particular degenerative joint. What can be treated? Here at Mountain View Rehab, we treat all orthopedic issues, knees, shoulders, hips, spine issues, elbows and wrists, hands and thumbs, and treating a variety of issues through each and every joint. And I'll get more specific in terms of the variety of injuries that can take place in each and every joint. Interventional orthopedics is a field of medicine that's relatively new. And ultimately, it really is a very important field to regenerative medicine, for it really is a critical field of medicine that ensures the success of regenerative medicine. What is interventional orthopedics? Well, that's essentially, in a nutshell, using image guidance, mainly ultrasound imaging or X-ray machines, to help guide the injections very specifically to the injury. Now, the correlate to this is, many of you are probably familiar with interventional cardiologists. There was a time when all heart procedures were done by cardiothoracic surgeons. And a cardiothoracic surgeon, in order to treat the heart, would have to expose the heart by opening up the chest. A very smart cardiologist discovered a way where he would pass a catheter to a vessel in the leg, guide it up to the heart using X-ray guidance, upon which they were able to apply treatment. And the consequence of this is, because it was such a significantly less minimally invasive procedure, which led to better outcomes and less side effects and poor outcomes, that this eventually ended up taking over 70 to 80% of what cardiothoracic surgery did at one time. So many of the leading minds in interventional orthopedics and regenerative medicine really feel that this game changer, if you will, is likely to change the field of orthopedic surgery in a very similar manner. In fact, over the course of the next 5 to 10 years, it is thought that this particular approach will replace up to 70% of orthopedic surgery. So again, it's basically using guidance to guide that needle so that we can deliver these cells, very powerful healing cells, directly to the site of injury or the area of need. Now, diving in a little bit further, what is interventional orthopedics? In the realm of orthopedics, there's a variety of procedures ranging from simple injections all the way to surgery. Now, most people practicing orthopedics do simple injections, and that's just simply taking a needle and putting it somewhere in the area of pain in hopes that the medication, more times than not, that being cortisone or steroid, can get to that injured site and provide some relief. Now, over the years with technology, ultrasound imaging has been more and more incorporated into many offices. And so a lot of folks have picked up these machines and using the machines to help guide the injection to get a little bit closer to the actual injury. But again, it's still very much a general approach, almost like a shotgun approach, if you will. An interventional orthopedist, what they're doing first and foremost is trying to identify very specifically what is the tissue within that joint that's causing the issue in the first place. So for example, in the case of a hip joint, there's a variety of tissues, including tendons and ligaments, joints, labrums, even bones. So first of all, first and foremost, identifying the specific issue, and then using the guidance to help deliver that treatment very specifically to that issue. So it's much more of a guided approach, a laser approach, if you will. And likewise with the knee, again, there's a variety of tissues that could be contributing to that pain issue. Again, tendons, ligaments, cartilage, bone, bursa. So again, it's identifying very specifically the issue itself and then treating that very specific issue. And then finally, in the case of a shoulder, again, there's a variety of tissues that needs to be identified. In some cases, it's a multitude of tissues. What do we inject? Well, first and foremost, most of what we inject are concentrated platelets, but we also inject another product called platelet lysate, which I'll explain in a moment. And then, of course, we also inject stem cells. Now, platelets are simply a cell that we obtain from blood. So it starts with a blood draw. And once the blood's drawn, then it goes to our lab here in the clinic where it's processed to very concentrated platelet solution. Now, within platelets, there's a variety of proteins, namely growth factors and cytokines, which, in a nutshell, is basically like getting an espresso shot to get that healing process up and going as powerfully as possible. And these cells have been very effective at healing injuries such as tendon issues or ligament injuries or labral injuries. We even use it for arthritic issues that are on the milder side. So anywhere from mild to moderate arthritis, we've found platelets are very effective at treating. The next product that we use is a type of platelet called platelet lysate. And the difference between regular platelets and lysate is that the lab, there's an extra step that's done in the lab where the membrane of the platelet itself is lysed, so that those proteins that are inside are available for immediate release. And we have found that this approach tends to be a lot less inflammatory and therefore particularly helpful at helping nerve injuries, such as pinched nerve from the back, or compressed nerves at the wrist, such as carpal tunnel or tarsal tunnel, which is in the ankle. And again, this is very effective at reducing that inflammation, but also providing a healing stimulus for the nerve as well. And then finally, we also work with stem cells. And stem cells are derived from bone marrow, which is something that we get from a bone marrow aspiration. So the stem cells a little bit more involved in terms of getting. But in a nutshell, the stem cells are kind of like the general contractor or a conductor of an orchestra, if you will. And what they do is they help organize all these various players that are involved with the healing process, get them to the site of injury, and work in a synergistic manner to get that healing process up and going as powerfully as possible. So with this, again, we're able to concentrate stem cells from a bone marrow aspiration, and we use this for more severe injuries. If there's a complete rotator cuff tear, for example, we might need something a little stronger like stem cell to address that. But we also use it for more severe arthritic changes, in addition to severe ligament tears. The procedure breakdown here in our clinic, approximately 80% of what we do is platelet injections, and consequently 20% of what we do is stem cell. And there is quite a significant cost difference simply because stem cells are quite a bit more involved. There's 3 different procedures, as I'll go into a little bit later, that are involved with a stem cell procedure that take place over the course of 3 days, whereas a platelet procedure is a same-day procedure and done with a simple blood draw. And that's important because it's important to understand that not everybody needs stem cells. Platelets are more than powerful enough to address the vast majority of orthopedic issues out there. So what is Regenexx? Well, Regenexx really are truly one of the pioneers of regenerative medicine, at least in regards to applications to humans, to us. Prior to that, most of our research that was done on stem cells and platelets was done by our equine partners who have been doing platelets and stem cells on horses since the 80s. So much of that research came from the equine world, but Regenexx really started picking up on this and doing more and more research for our own personal orthopedic issues. And really they have not only developed the field of regenerative medicine, but interventional orthopedics, and have devised and synergize these two aspects of medicine to really provide us with an advanced regenerative medicine alternative. So again, they've been the pioneers in this field. They've been doing this since 2005. And not only the pioneers in terms of developing this, but one of the biggest pioneers as far as pursuing the research and knowledge of both of these fields. Now, as many of you likely already know, when it comes to looking at regenerative medicine alternatives, there's a lot of options out there in regards to clinics. What I hope to do next is really explain to you how the Regenexx approach is far different than any other clinic out there. And it's different from many standpoints, ranging from experience to research. And as I'll go into a little bit later here, research really is a critical factor in terms of really, this whole regenerative medicine is a very young field. We're still learning a lot. And so, this field is still evolving. We're still learning. We're still learning ways to make this better and better each and every year. So I'll touch upon each and every one of these aspects of difference. As I alluded to earlier, again, Regenexx really is the pioneer of both of these fields. They've been doing this since 2005, and experience accounts for a lot. And ultimately, I think many of you will agree that the more experience one has, the better the outcome, the better potential outcome is going to be. So again, been doing this. Regenexx have been doing this since 2005. One of the biggest areas that we differ from most other clinics is our lab platform. Most clinics that are offering this treatment have a simple bedside centrifuge, which basically you get the blood draw. The blood is placed in a centrifuge. 5 to 10 minutes later, you have the clinic has the platelet, and you get the injection at that time. The problem with this approach is that everybody gets the same treatment, which is, as you can imagine, everybody's a little bit different. And so treatment really, to become most effective, really has to be customized. There's no customization in just the basic centrifuge approach. The other problem with this is concentration. The concentration of platelets that we've learned, the higher the concentration you get, the better the outcome. You're just not able to get the higher concentrations with this basic format. So with our lab platform, yes, we have a centrifuge process, but we have a full-on lab with a hood and all the various tools and equipment that are utilized to process to a higher degree. And there's a customization process. And again, not one approach isn't necessarily going to work for everybody. So we're able to analyze the situation, decide which approach and dosage is best for that individual, and produce that particular dosage. So again, this combination of customization as well as concentration really does lead to far better outcomes. Regenexx cell source, this applies specifically to the stem cell. And Regenexx is only using bone marrow as a source of stem cell, namely because it's the only one that's compliant with the FDA. But also it has been researched and vetted far more than any other source out there, namely adipose and this other source that we'll talk a little bit about later, amniotic. So it's deemed the most safe and also the most effective. So stem cells, we only get it from bone marrow. Again, we find that this gives us the best outcomes. We've also done a lot of research on harvesting, which is the aspiration process and how we get the bone marrow. And we've found ways to harvest and collect the bone marrow that is different than most other clinics that really help optimize the number of stem cells. And particularly when it comes to stem cells, we've discovered that the more cells you have, the much greater the outcome. There's a definite correlation between number of cells and how successful this procedure is going to be. Dosing, I touched on a little bit earlier. We have special machines that's able to measure the amount of cells that we have after the processing of stem cells, for example, or even platelets. So, and through this process, we have discovered that, in order to have an optimal outcome, we really strive to get a certain number of cells. And by having the proper machines to analyze this, we are able to, give greater assurance of, proper dosing, which again, ultimately results in better outcomes. I've already kind of stressed the importance of image guidance. Again, without proper guidance, this approach really is not going to be successful. And then we'll jump into next the importance of research. And our research really starts through our data registry. Any person who becomes a Regenexx patient is invited to join a registry, which is it's a registry that follows each and every patient for 5 years outside the procedure, following outcomes just to see how people are doing. And again, if we're going to advance this field, if we're going to optimize this field to be as good as it possibly can, we really have to continue to push the research. And this really, the registry really is the core of our research. And it's this information that has allowed us to be one of the world's leading publishers in regards to regenerative medicine. Over 44% of the world's literature comes from Regenexx. And again, this is ultimately coming from our registry information. So this information feeds our clinical research. Again, this is still a very young field. We still have a lot to learn. What we're doing now is better than what we're doing 5 to 10 years ago. And more than likely, in another 5 to 10 years, it will continue to get better yet. And this applies to our lab research too. Our Regenexx headquarters in Colorado has a university-based lab setting, and they are constantly doing research, again, constantly trying to make this whole approach, this whole method better and better. Anybody who is an affiliate of Regenexx is a specialist. Orthopedic medicine is all we do. You'll find that a lot of other clinics are run by general practitioners, or sometimes they're not even MDs at all. A lot of these procedures are done by nurse practitioners or PAs. Not with Regenexx affiliates. Again, orthopedic medicine really is our passion. This is what we know. This is what we do. And again, that's ultimately going to lead to a greater outcome, greater success. So our procedural visit flow starts with, in the case of a platelet procedure, we always spend an hour with the patient on initial evaluation. And from this, we're able to examine, get a history, and ultimately decide what the diagnosis is, what the problem is. And from there, we're able to provide a prognosis of how one may respond to this particular treatment. And if it's decided to go through with a platelet procedure, again, that starts with a blood draw. Once that's drawn, the blood goes to the lab where it's processed. It takes about an hour and a half to process. And so the individual is brought back a few hours after the blood draw for the re-injection. More times than not, that's followed by physical therapy to, again, go over the rehab process, which really is, I think, an important part to optimize success from these procedures, because it really can help address mechanical deficits that have led to the initial injury. And then we typically see the patient back a couple months after the procedure to see how things are going. A stem cell, a little bit more involved. Again, it does start with the 1-hour initial evaluation. And then if the stem cell is recommended, it's a 3-day procedure, usually done on the Monday, Wednesday, Friday schedule. The first day is a prolotherapy injection, which basically gets the tissue ready for the stem cell that we do 2 days later. And then on the stem cell day, that starts with the aspiration. After the aspiration, it takes about 3 to 4 hours to process. So we do the aspiration in the morning and usually bring the patient back in the afternoon for the re-injection. And then we follow that by a platelet injection 2 days later. And in this case, we get the platelet from a blood draw and then re-inject a few hours later. Again, this is oftentimes followed by rehab. And then we see the patient back in a couple months after the procedure. So just to touch upon some of the stem cell hype, again, this is a very exciting field. And with the excitement of media et al. And what have you, it does develop some bad players who are really trying to make a quick buck. And one of the biggest culprits of this is this world of amniotic injections. And many of you probably have come across this already. There's a very aggressive marketing campaign done by multiple clinics. And the biggest problem with the amniotics is that there's been numerous research done, not only by Regenix, but by at least a dozen reputable university-based research facilities. And what each and every piece of research has shown is that there is no live stem cells in this product. Now, to be fair, there are other growth factors that are in the product, but because there are no live stem cells, the FDA has essentially registered this as a dead tissue product, and consequently is illegal to actually market as a stem cell procedure. And this has been the case for probably a good 10 years now. But because it was such a small world, it really wasn't regulated until the last couple of years. But finally, it is being regulated. And the result of that is many of these clinics are being shut down. And many of these clinicians are actually serving jail time. Again, there are growth factors. So in the amniotic product, so there are some healing factors, but the amount of growth factors that it's available in this product pales in comparison to even platelet injections. And interestingly enough, tend to be many times more expensive than platelets. Many of these procedures are done in chiropractic offices, typically without guidance, oftentimes by a nurse or a PA. And again, can't emphasize enough, these are dead cell products, no live stem cells yet whatsoever, yet they're sold as stem cell procedures. One of the marketing schemes that they'll throw at people is that they'll tell you that your stem cells are too old. The fact of the matter is we've researched this area quite a bit, as have other university-based settings. And we have found that there is no correlation between age and how well people do with this approach. In fact, I've treated a handful of people, as old as 97, and they still have done well. So, and again, just it's important to understand that this is not true. And again, this is a dead tissue product. So as you pursue, your further research in this world of regenerative medicine, there's a number of red flags just to kind of keep in mind as you're doing research. Many of these companies, particularly amniotic companies, are offering heavily discounted, prices on this, or heavy emphasis on financing. This is probably a red flag. Many of these clinics are also suggesting that not only is it going to cure orthopedic issues, but it's going to address your diabetes. They tend to sell it as a magic cure-all. That more than likely is going to be a huge red flag. So beware of that marketing approach. Furthermore, there is no discrepancy. Everybody is a candidate. They don't provide anybody with a prognosis. Everybody can benefit. That too is a red flag. And I've hammered this in enough. Again, it is not a live stem cell, nor sometimes they call the amniotic product a cord blood product. And again, they'll advertise it as stem cell. It is not a stem cell. Now, there's another source of stem cells that seems to be very effective, but at this point, the fat stem cell is illegal, in part because in order to make that viable, there has to be an enzyme process to it, and the FDA has defined that as over manipulation, and again has made it illegal to do that particular approach. So who can you trust in your research? I've come across a website called Stem Cell Review that I would invite you to copy down this website address. And they give a nice unbiased review and try and rank each and every clinic that's providing this service, this treatment, on a number of categories. So give it a look. I found it to be a fairly unbiased source, and I think it can help you with your research. So in summary, again, this technology, very exciting treatment, really can be a very powerful treatment option to restore movement without surgery. The combination of regenerative medicine with interventional orthopedics really is critical to optimizing the success of this field. Regenetics, one of the leading providers, one of the pioneers, and certainly one of the greatest sources of research when it comes to this field. And finally, be cautious of the magic stem cell approach. So that's the core of our discussion today. What we'll do next is jump into a little question and answering. I'll leave this page up so that if you have any questions that come about after the webinar, you can certainly give us a call. That number is our educational line. You can also get quite a bit of information on our website at Mountain View Rehabilitation. And then finally, if you find that you might be interested to come in and for a visit to see if you might be a candidate for these procedures, give us a call and we can certainly get that set up as well. So with that, let me switch over to the question and answering phase. So let me press a few buttons, and first on the list is Denise. Let's see, can you hear me, Denise? Hello, Denise? Can you hear me, Denise? Let me press that again. Well, maybe some technical difficulties with Denise. Let me click it a couple more times. So Denise, if you're not able to get on, maybe just, you can text in a question as well, and Dana can read that over to me, and we can try and address your question that way. Anybody else that might have some questions? Okay, and as I mentioned earlier, or as Dana mentioned earlier, if you want to review this webinar, this will be available on our website, and I believe Dana might even send a link to it after we're done here, and it's up and ready for broadcast. So any questions? Okay, let's try Mike Kelly. Can you hear me, Mike?
Yeah, can you hear me?
Yes, I can hear you. Hi, how are you?
We're doing pretty good. I got a question. A couple of years ago, I had uh, my left leg, my left foot was turning in, and I went to the VA, and they did one of these needle things. You check your current, see what your muscles look like, the current on your leg, and they found a blockage right below my knee on the outside bone, about 4 inches down, a peroneal nerve. They
Uh-huh.
they went in there and they found it, and it was like a piece of cartilage, like a steak was on there. They opened it up and they cut that cartilage away from my nerve, and it gave me about 30% more strength. Not much, but 30%. So my foot doesn't turn as it used to,
Uh-huh.
but I still have weakness. I mean, is that the end of the game for that nerve? Is there anything else on that?
Well, how long ago was the surgery done?
2 years, 3 years ago.
Okay. Okay. Yeah. So, most surgeons, most clinicians will tell you, it might take a couple of years really to get optimal recovery of that. Thereafter, you're less likely to get recovery. Um, but we have found that our platelet lysate procedure can help with nerve restoration. So we have seen some recovery of nerves with the lysate procedure.
Yeah, the neurologist told me that the nerve will grow back about 1 inch a month or something like that. And like I said, it's got a little bit better. It's been a while.
Uh-huh.
But do you have time for one more question on that?
Sure. Yeah, go ahead.
I had my lower back fused about a year and a half ago. I had terrible pain, and an orthopedic surgeon here in Reno, nice doctor, did a good job. The pain is gone.
Hmm.
Um, they they put in 11 rods in it like a cage, and
Sure.
then somehow it got infected. They had to go in 6 weeks later, clean it up. I had to have a pick for 6 weeks. That's miserable. Uh,
Yeah, no, that's no fun.
but they said that there could be a biofilm on the metal rods, but my bone fusion wasn't strong enough to take the rods out. So I got me on this level flexing for quite a while. Then it dropped down to a C Pro of some kind.
Uh-huh. Uh-huh.
But anyway, where I'm going with this, about a year and a half later, about 10 months, my bones were strong enough. They took out the rods, and the pain is gone. I'm thankful for that.
Oh, fantastic.
Yeah, I'm 74, so I'm not a chicken. I'm not dead yet. Um,
Okay.
but with the byproduct of that, and there's always possibilities, is that my knees, from my knees down on both knees, it's some about 50% numb. Like I got compression socks on or something. And my toes, though, I got feeling in my toes. But from my toes back up to about my lower knees, it's kind of numb, about 50% numb, I would say. And I'm weak because of it. I go to the gym about 4 times a week and do some moderate exercise, which really help, by the way. So is that just a byproduct of surgery? And is that the end of the line? I'd be thankful I don't have no more pain and deal with it.
Well, and I'm sorry, you said the numbness is above your knees?
Below my knee, both
Below
knees.
your knees. Okay. Okay. Um, and do you recall which level was fused? Did you say L45?
Yes, 4 and 5. They put a couple of those. They fused them. They cut off those humps in your back, and they lay them alongside your ribs, um, and but 4 and 5, where it starts to go down, makes that curve a little bit lower towards my tailbone. If
Yeah,
it,
yeah.
if it, get-
Okay.
if it gets too low, you got to go inside your stomach. But they did this from the outside.
Gotcha. Well, um, so it's mainly the numbness that you're experiencing, not necessarily weakness as much.
I
I
numbness
mean,
and
in
some.
that scenario, you almost have like a double crush. I mean, if the L45 level was the level in your spine that was causing issues, and a lot of times that level is what causes the weakness to the foot. Um, your other issue. But you're saying that they decompressed that at the knee.
They the L4 and 5 again. I don't recall the specifics. I'm not a doctor, but
Yeah.
they decompressed it. They
Okay.
they cut out those little humps, those dinosaur things. It's about 8 or 9 inches from my butt up.
Okay.
And they laid those pieces on the side end. But because of that, and right after the surgery, I noticed my knees were numb. I mean, from my knees down, below my knee.
Yeah. Yeah.
And but not the toes.
Okay. Okay. Well, that's interesting. I mean, I don't know that there's much that can be done to get the sensation back. But again, the foot drop that you're describing earlier, I mean, that is something that you say you're 30% better since that's
in strength. The outside muscle, it makes your legs straighten out.
right. Do you feel like you've plateaued at 30%, or you feel like you're still getting some recovery?
I plateaued, I think, at 30%.
Okay.
That I feel comfortable saying that.
Okay. Well, so I mean that is something that certainly trying to strengthen it as much as you can with exercises is always going to be the first and foremost recommendation from that standpoint. But yeah, I mean, platelet lysate is something that might be helpful for that as well.
Yeah, I could maybe call up later on that. On those two legs, they say it could take a couple of years. I do exercising on a rowing machine and on that elliptical where you stand up on that thing, sort of. That really has helped, but
Yeah.
it's numb and it's still a little bit weak. And I don't know, I'll take what I got. I'm thankful for not having the pain.
Yeah. So, I mean, it would certainly be worthwhile taking a look at. So, again, if that's something you wanted to pursue further, let us know. We can take a look at that and see if you might be a candidate.
Yeah. Do you believe in that chicken fat injection?
Chicken fat injection? Mr. Crow?
It's not really, they call it chicken comb.
Rooster comb, yes.
Yeah.
So it's a lubrication injection. And yeah, I mean, it can be very effective at knees, for knees. We do quite a bit here for knees, actually.
Yeah. Okay. Well, I don't take up a hog all the time, but anyway, well, thank you. I can get.
Oh, yeah. No, well, thanks for the questions. Thanks for joining us tonight.
Yeah, you bet.
All right. Well, take care.
Okay.
Okay. Well, thanks, Mike, for that question. As I say, if there's any other questions, go ahead and raise your hand. But again, if not, and questions do happen to come about after the webinar tonight, don't hesitate to give us a call, or if you think you might want to look to see if you might be a candidate for this, to take note of our information there and give us a call. Now, any questions on your end, Dana? Do you have any text questions that came in?
No, they've been answered either by you or by me. It looks like Mike might have another question. And
Okay.
Denise, if you can hear me, if you want to type your question out in the Q&A, I could read that off to Dr. Richnack if for some reason he's not hearing you on the audio. So that's an option.
All right, well, let's see. Mike, did you have another question?
Well, I hate to hog this up, but I got
Not at all. There's not too many hands out there, so go ahead.
Well, he's 84, 83, and he had really bad knees, bone on bone type of thing. And he went and had some injections. He laid on a table and they took it from the back of the knee. I think they charged him $4,500 for one and $500 for the other since he was in the office. But they took it out. They injected something back in there, And it helped for about 4 or 5 months. He can go up the stairs, but not down very good. He could sit without pain. But after 6 months, it wore off and they wanted him to go in and have another injection. Is this normal?
What was being injected again?
Stem cell of some kind.
Oh, well, I'm guessing this is probably one of the amniotic products that we were talking about earlier. And yeah, I mean, it can help for some folks, but it tends to be very limiting. And, because it is very low in growth factors. In fact, as I mentioned earlier, it can't even hold a candle to platelets, let alone stem cells. So yeah, it tends to be a very expensive product. They label it as stem cell, but it is not stem cell. So yeah, I mean, I know there's a big clinic in Reno that was marketing that very, very, very aggressively. They even came over to Grass Valley and, 6 weeks or a couple of months worth of newspaper ads every day, full page ads, and they had seminars and educational seminars, and yeah, I mean, huge. I don't think they're around anymore because I believe the FDA may have shut them down.
Yeah. I mean, but is this the product that you do? Is this an ongoing, like glasses, you got to get an inspection every 2 years?
Well, so for stem cells specifically, we oftentimes, with the bone marrow approach that we use, we oftentimes get up to 7 to 10 years of symptom relief from that.
Oh, okay. That makes sense. We had a butcher here. He had 2 hips replaced, and he had that chicken comb put in by the VA. He said it lasted him 6 or 7 years. I don't know.
Oh, yeah. I mean, some people get lucky, and that can help that way. So,
Yeah.
a little different from that standpoint.
Yeah. Well, anyway, that was my thing. Thank you.
Okay. Take care.
Dr. Richnack, so Denise did type in her question, and she just wants to know how long the platelet procedures last.
Well, so it depends on what we're treating. I mean, for example, if we're treating like a rotator cuff tear or a meniscal tear, it can heal that issue, and with the right heat rehab, it may never come back. In the case of arthritis, if it's mild to moderate, oftentimes we're getting many, many years of relief out of that. If it's more severe, the platelets may last for only a year or so, sometimes longer. So it really kind of depends on what exactly we're treating. Again, for some issues, it can be it can heal, but for other issues such as more severe arthritis, it's more of temporary. But we're talking anywhere from 1 year to 3-4 years, depending on the degree of arthritis. Okay, I hope that answers your question. Well, I think Mike might have another question. Let me try Mike one more time.
No, I didn't have one. I'm
Oh,
sorry.
okay.
I'm sorry.
Your hand was still up. We'll have to take that down.
Oh, okay. Whoops.
All
There.
right. Take care. Bye-bye. Okay, well, so as I say, I mean, Dana will send out links once the webinar has been available for broadcasting, in which case, you'll be able to review it at another time. But again, if you have any other questions that you want to ask directly to the clinic after we're done here, don't hesitate to contact us. And again, we certainly would love to evaluate you to see if you might be a candidate as well. So any other input from you, Dana?
No, I don't think so.
Okay.
Covered it all.
All right. Well, on that note, want to thank you all for coming out tonight. Appreciate it. And take care and have a happy holidays. Bye-bye.